We have a panel discussion today covering practice perspectives for enhancing community care. This session, we're having a more of an informal discussion, and we'd like to engage the audience later on after the three speakers give their perspective. Unfortunately, Ellen Pedersen is unable to be here today from Langley Division of Family Practice. She sends her regrets, but we have three others. We're going to start with Catherine Combe from George Derby Care Society, followed by John Pickering, postdoc, Simon Fraser University at the Gerontology Research Center, and Anthony Cooperschmidt from the City of Vancouver. And each is going to say a little bit about themselves as they give their lens view of practice issues. So I'll turn this over to Catherine. Thank you.
Thank you. I have a confession to make. I spent the first half of my career working in acute care in the community, and I didn't really think about gerontology, geriatrics, or seniors. But I saw the light, like Louis, and came to the right side and proceeded to work in long-term care. I think as I get older, I think I'm wiser. Billie Jean King said that we should not be like tennis players because tennis players are there for who? Themselves. Now I know that I am working, or I'm semi-retired, for the audience, which is the geriatric community, and because I'm part of that community, I think I finally get it. In my old life, I did a lot of programming, inventing programs, being innovative, which always worried me, Gantt charts, project management, and that was all good, but now that I'm wiser, I have learned not to multitask and to listen and to focus, and it's actually better. So I'm going to talk about some small changes because I'm really in love with small change, and it's not just me, because once I started thinking about it, of course, Harvard Business Review and everybody has written about small change, because small change is not scary because there's no innovation word in there. It's doable, it's sustainable, and it's actually fun. So I'm going to give you three examples of some change. When I was working in an unnamed large home in Ontario, I just have to, an aside, first day I got there, I knew nothing about long-term care, and I walk into the office and sit down, and everybody says, "Oh, the ministry's here." And I thought, well, isn't that nice? I've just started this job, and the ministry is coming to welcome me. Little did I know, of course, it was a complaint, and I was handed the binder of 416 regulations and thought, oh, I don't really know anything. So that was the beginning of my new journey, which was a really good journey. The thing that horrified me was that residents had baths once a week. Now, I don't know about you, but I'm into showers, and I like lots of them. And I was horrified. And when I chatted with the residents, they just said, well, that's the way it is. And the other thing that bothered me is Tuesday afternoon at 2 o'clock, Catherine has to have a shower. That doesn't kind of work for me. So I sat down with a group of care aides because I knew there was no more funding. And I said, I didn't start with what I wanted. I said, how often do you all shower? And they told me, everybody, once, twice a day, and when do you shower? Before I go to bed, when I wake up. So I said, well, how do you think it is for some of these people? It was a small group. And how can we change it? We're not going to be able to hire more staff. So they came up with a great idea. It wasn't me. They said, let's start with 2 or 3 people. Just put a whiteboard in the shower room so we can just write down who had a shower when, and we'll just ask them. And, you know, it was fantastic. I didn't really do anything. I just gave them a voice. And some people did indeed move to 2 baths a day. And then I always remember this one gentleman, he said, well, I grew up on a farm and I would bathe, you know, once a month, so that's okay. And you know what? Worked for him. It was fine. Another example is an interview process. When I worked in long-term care, some of the candidates coming in for positions would, I kind of think, these people don't know anything about long-term care or who we're serving. So I got the bright idea, why wouldn't I have a resident join us in this process? And it wasn't hard because, you know, they all volunteered, of course. Yeah, we'll come in. This is fun. You know, you're going to sit in her office. She'll probably serve tea, and then we can interview people. It was fascinating because the candidates right off the bat, because some of our folks were, of course, living with dementia or had not interviewed before, so they just pop a question up like, how many sisters do you have? And they just got, you know, the really good candidates would respond to the question, and you knew right away who you were going to hire. The only challenge was if, you know, I thought it was person A and the resident thought it was person B. It was a long discussion. But great process, small change, little change. But then we started having always a resident. If it was a higher position in terms of a director of finance, I kind of looked for someone who had a finance background. But it was just really, really fun. And I'll share one more experience with you. When I was working with a health authority here, and my role was to look at transitions. Now, we all know that transitions are not patient, resident, family focused. How many times, I hate to tell you, when I managed Emerge, did we send people home, you know, wearing a gown? It's bad. And just to let you know, that's not a new problem, because when I was managing Emerge, I found a paper from 1896 written by a physician who was talking about the backup in emergency departments. So none of this is new, which is why I love small change. And I don't use the word pilot project anymore either. Everything's a soft start. So you can see I'm much nicer as an older woman. So here we are with the hospital and long-term care homes in one of the districts in a health authority. And when I visit the hospital, they're complaining about the homes. And of course, the homes are complaining about the hospital and who's caught in the middle. So I thought, well, this isn't rocket science. Why wouldn't I just bring everybody into the same room and they can talk to each other? Like, really? So, but you have to have food, I know that. So you feed them lunch. And, you know, it was amazing. In fact, I just had an email. I think I've been retired from that health authority for 4 or 5 years, and I just got an email yesterday saying, guess what? These groups are still going, which is great because you worry about sustainability. So I think my learning, because I do consulting now, is small change. No innovation word, no big Gantt charts, no big proposal. We'll try a soft start and see how it works. And it's actually much more fun because I'm not good at Gantt charts. So small change is what I would recommend. That's not to say that big projects aren't wonderful that Suzanne talked about this morning. But what I'm promoting is, I sound like Leah, you know, go call 2 people. Just something teeny weeny. It's fun. That's my thing.
Thank you, Catherine. Turn it over to John next.
Hi, everybody. I'm John Pickering, the Real Estate Foundation of British Columbia postdoctoral fellow in the Gerontology Research Center here at Simon Fraser University. I work very closely with Dr. Wister. My disciplinary background, though, I'm coming at this more from the academic side of things, obviously with the position, but my disciplinary background is more in geography as a human geographer, just fancy way of saying I'm very interested in place. And my original research was really focused on things like transnational health and healthcare access. And in this role, since joining the gerontology department, I've really shifted into looking at things like social isolation, loneliness, and the serious health implications that those carry. But part of my role is, it kind of mandates a consideration of the environment where people live, obviously just by the title alone. And I've really developed a strong focus on using, rurality as a lens to imagine. As we've heard through this, all these talks today, there's so many groups of people that get left out, and we do use terms like older adults or seniors, but there's such a wide variety of life that goes on within. So my focus has been primarily on those older adults that are living in rural areas and trying to understand what that means, and for the day-to-day really. We've done more academic work on the side of looking at reviews and things and compiling those and trying to create something for other academics to be able to use. But more recently, I think connected to this discussion particularly, and a lot of what we've heard today, we've just recently launched a study that's looking at Port Hardy, which is at the very north part of Vancouver Island. It's a small community. To be honest, I thought it was very rural and remote. There's one road in, one road out. It's 4,200 people. I got there and was greeted by a Subway, A&W, McDonald's, Save-On Foods, and I was very confused and a little bit worried. But actually talking to people, it is its own community in its own way, but it is cut off. My research assistant on the project, Shauna Hopper, is here, or was here earlier, but we conducted 27 interviews in 3 days and really learned a lot in a very short period of time. This entire day for me has been a reflection on that, actually, because so many of these talks connect so deeply with the issues that we were confronted with. Perhaps naively, I rolled into those interviews with the assumption really that housing was a major issue of the Lower Mainland here in BC that affects me, and I was very shocked at the way that housing, in terms of a crisis, really impacts people in a place like Port Hardy as well. Not to divulge too much, and I am very reticent to share findings before you move into publishing and all those things, but protecting people's identity and whatnot. But I did speak to someone who was over 90 that was living in a house that was larger than 3,000 square feet, and they really admitted to using the kitchen, bathroom, sitting room, and the bedroom, and that was it. And they expressed, along with other participants in the interviews, how much they would love to move to a single-story house that was nice and clean and new and had a back garden and was very close to healthcare services and the senior center that they're very connected to in that area. But that doesn't exist. And probing that, we also had the chance to talk to councillor members there and an ex-mayor, and they said, if a housing builder wants to create houses and they build them in Victoria, they make 4 times to 5 times the amount that they'll make if they do it in Port Hardy. So it's not going to happen, even though the desire's there. Attached to that, which was an issue that I had no idea would emerge, is that, well, emerge is the right word, but the emergency department in Port Hardy actually closes at 5 p.m. because, of course, no terrible emergencies happen after 5 p.m. The closest emergency center is a 35-minute drive, and that's quite an arduous task, say at 2 a.m, when maybe you're very close to driving cessation and, driving isn't in your comfort zone anymore, and it's difficult to drive at night and so on. But part of, probing into that and trying to understand what was going on, one of the largest issues they had was this problem with family physicians, which has kind of since rectified with what's turned out to be a large dispute between private practice and Vancouver Island Health, which I'll skip. But just getting nurses into the area has become their biggest challenge. And a lot of nurses have families that they want to bring to the area, and there are small apartments, but there aren't houses, especially large ones like 3,000 square foot houses, that they might be able to move into with their families. So this is this, interconnected issue where suddenly now we have seniors that are stuck in houses that are too big and too difficult to manage with nowhere to go, which also holds up housing stock. So they're not able to have all these professionals that they actually need to move into the area. So it's, for me, it was I knew so many issues about what was facing aging in a rural setting, but I was really confronted by how acute so many of the issues are, and how long-term and chronic they are. In Canada, we don't have a Ministry of Housing to oversee these kinds of things. It's very obvious when you're there, even in my limited urban studies connection, to know that some higher level planning is needed, probably from Victoria, to imagine how issues in Port Hardy are going to eventually work their way down to emergency centers or specialty services for healthcare in Victoria, because they're not being able to be managed where they are. So that's kind of my background, where I'm coming at things today, and hopefully we'll have a chance to talk about that a little bit further.
Excellent. Yeah. Thank you, John. It's interesting to get this kind of a rural perspective, which we don't often consider, to add to our many levels of intersectionality and diversity. I've asked Anthony actually to wear two hats today. One, the City of Victoria, but also he is on the steering committee or executive of Costco. Is it the executive?
Yeah,
Sorry.
executive.
And maybe to fill some of Ellen's shoes, because she was unable to come here and represent Costco. Anthony will say a few things, just a few points from that perspective as well, to capture these diverse perspectives on practice.
Yeah.
Anthony.
Thanks, Andrew, very much. I appreciate that. Our panel has shifted a couple of times in the planning of this, right? The original plan was to have Leslie Gaudette, the president of the Council of Senior Citizens Organizations of BC, serve on it. And as you heard earlier today, there's a bit of an important meeting happening in New York with the UN right now, and she's actually there right now representing the voices of seniors, which is phenomenal. So she's got a good excuse for not being here. And she brought in Ellen Peterson, who's the executive director of the Langley Division of Family Practice, who I had the pleasure of working with when I was working at the Langley Senior Resources Society. So I'm going to try to do my best Ellen impression as I can. She shared a couple of talking points, so I'll share those, and then I'll maybe shift into what I was going to share. The Langley Division of Family Practice serves both the city and township of Langley, and I think they are really doing their best to try to do some leading work around primary care in those communities. They're really working hard to integrate primary care and community supports for older adults. There's a very strong agency collaboration there locally between the Langley Senior Resources Society, which has a senior center and both an adult day program, the Langley Seniors in Action, which is a seniors community planning table. There's a Langley Meals on Wheels, Langley Community Services Society, which does a lot of work with immigrant populations, the Lower Fraser Valley Aboriginal Society. These are all agencies that are working collaboratively with the Division of Family Practice around supporting and meeting the needs of older adults locally. So they're doing some really good work around enhancing patient attachment and recruiting care providers, including family physicians and nurse practitioners. They have a MedWatch program. They do a lot of work around advanced care planning and really making sure there's strong both patient and physician engagement in that work. So we heard a little bit about advanced care planning earlier today, so I think they're really doing some good work in that area. And they also got a good scope around care provider supports and services and continuing education, things like a long-term care network. They have an Ask an Expert program, so it's to support physicians with others with other areas of expertise or experience. An after-hours coverage program are just some examples of what they do. But they have been building their primary care network, and they're really focused on team-based care. And they really do a good job around engaging older adult allied health support, including physiotherapists, nutritionists, clinical pharmacists, clinical counselors, nurses and social workers. So those are just a couple of points that I know that Ellen was going to share today. And I think it's important, coming back to some of the conversation we've had earlier today around social prescribing and the integration of community supports and the formal healthcare system. The divisions of family practice, I think, are in many cases really trying to bridge that gap as best as they can. So I'll stop pretending to be Ellen for a minute, and I'll share a little bit about my work and what I'm doing and my connections, and to just rein me in at any point because I want to have lots of time for conversation. But I am wearing a couple of hats today. So I do work with the City of Vancouver in a fairly new role, trying to lead policy planning and strategy for the aging population. There's only 3 municipalities in BC that have a dedicated role like this at the moment that I'm aware of, Vancouver, Surrey, and Richmond. But I also volunteer on the Council of Senior Citizens Organizations of BC, or COSCO BC. And I am an SFU Gero Master's grad, just because I know other people were saying that earlier too. So I got to get that in there. So yeah, got to do my best or I might not get invited back next year. So yeah. We've talked about, innovative approaches for aging in place today. We've talked about social prescribing, community supports for diverse and marginalized communities, housing needs and supports. For this panel, I really latched onto the words practice support, and I sort of interpreted it a certain way. And so I'll see where this conversation goes. So I was thinking about what can I bring to this topic. I could speak about my experiences helping to lead senior centers, but I know we're going to hear from other senior centers later in the conference program. So instead, I thought I would focus on age-equitable communities, or what is sometimes called age-friendly communities. I'm trying to change that language and use more of the age equity language because I don't think it's enough just to be friendly towards older adults. I think we need to do better in this area. So if I ever get the direct line to the WHO, I'm going to suggest they make that change. So yeah, we'll work on that. So I'm really, an age-friendly community, part of what my role is supposed to be is ensuring that there is a coordinated approach to both meeting the diverse needs of the aging population and enabling society to benefit from the strengths that arise from an aging population. So I was leading a senior center here in Vancouver during the COVID pandemic, and despite the best efforts, the City of Vancouver coordinated response, I will say could have been stronger. And it sort of inspired me to want to try to work at a little bit more of that systems level to try to do more to be supporting the agencies on the ground, trying to meet the needs of the aging population. And so from a practice support perspective, when you think about age-equitable communities, I think about, building municipalities to create the environment that supports and maximizes community assets and programs and services and approaches. So trying to elevate all the work that many of you are already doing in the community. And so that requires that coordinated approach. And the model that we often talk about is the World Health Organization and their Age-Friendly Cities and Communities framework. Which has 8 domains, and I'm going to talk about it through the BC lens. So hopefully many of you are familiar with some of these, but the pillars are social well-being and participation, respect, social inclusion, and cultural safety, including responding to ageism, for example. Community support, health, and wellness services, so both community-based agencies and healthcare services. Housing, which we've talked about. Transportation, outdoor spaces and buildings, built environment. Community engagement and employment, including volunteering and civic activities like participating in elections, and communications and information. So those are the 8 pillars of an age-friendly or age-equitable city. There's only 6 municipalities in BC that are part of the international global network of age-friendly cities. Cranbrook, Maple Ridge, Oliver, Saanich, Surrey, and West Vancouver. So if you work or live in those communities, congratulations, that's great. We got a lot more work to do, I would say. But being an age-friendly community, from a municipal employee standpoint, that could mean anything from what are we doing to encourage the installation of curb ramps, to the grants that we provide to community-based agencies, to how do we support collaboration between different levels of government. Again, now coming back to the practice support perspective, there is in the province of BC a BC Age-Friendly City Recognition Program. Started in 2005. It involves grants, resources, there's capacity building supports. This is currently funded by the Ministry of Health, and it's supported by a provincial agency called BC Healthy Communities. And I think a fair bit about how we could strengthen this, because, for example, the City of Vancouver has been an age-friendly city since I think it's 2004. But there's a lot of good work that hasn't been done in the last decade. So a city can achieve this recognition status at the provincial level and then I will say rest on its laurels. And so I think, and I think we need to be doing a lot more. The example I often use is Vancouver doesn't have a complete sidewalk network. And can you really say a city is an age-friendly city if it doesn't have a complete sidewalk network? So just some of these things, there's always room that we can improve. There's 61 municipalities that have been recognized by the province as age-friendly cities. It's not been evaluated since 2010. It's quite static in that regard. So again, from a practice support perspective, what more can we do to enable municipalities to do good work around age-friendly cities? There's a couple more things if I've got some time. Andrew, wanted to talk a little bit about the Social Sciences and Humanities Research Council, the SSHRC Insight Grant that Andrew Wister is leading and John's part of as well. So these two jump in at any point. But Costco BC is part of this work. And I mean, it's very focused on social connectedness and resilience among marginalized older adults and caregivers, looking post-pandemic, of course, focusing on seniors at high risk of social isolation or experiencing stress and anxiety or depression, facing challenges completing daily tasks, and caregivers as well. This is a project focused on BC and Quebec. It's really about building a research network of community agencies and about developing evidence-based response to organizational needs and then implementing strategic interventions. So again, I think about practice supports. How can we better support these organizations to be delivering the programs and services that are needed? So that was just one thing I wanted to mention. And now to channel Leslie Gaudette from Costco a little bit. Just a little bit briefly about Costco. They've been around since 1950. I think we heard their motto uttered earlier today in a different sort of way, but their motto is very much planning with seniors and not for them. They're an advocacy organization that unites a wide variety of seniors groups around the province, sort of under one umbrella. And some of the work that I've been supporting with Costco is trying to do some mapping of the different seniors groups across BC. And Boa Kim, is Boa, I know Boa's here, she might be outside, there she is. So Boa has definitely been instrumental in some of this work. So Boa's a PhD student at SFU, and there was a MyTax grant that enabled us to do some of that mapping, and that work has supported both the SSHRC grant and this Costco focus, trying to better understand all these different agencies, often operating in smaller communities where there's not a lot of recognition or understanding about all the good work that the senior centers, for example, can have at that local level. Really what we want to do is grow that critical mass so that all these agencies and seniors groups contribute to the larger conversation so we can do more to influence decision makers around advocacy issues. And I think it was mentioned earlier today, the important role that advocacy can actually play as a practice support again, right? So encouraging that. So I think I'll stop there, but thank you. And I'm really looking forward to seeing where the conversation goes. So, yeah.
Thank you, Anthony, and all of the speakers, Catherine, John. We missed Ellen, and thank you for stepping in for Ellen. But we wanted to kind of have a little more of an informal kind of engaged discussion around some of these practice components, and you heard a number of really important points raised. But we also wanted to open this up to the audience. And I know a number of you do work in the area. Of course, you're here because you work in the area, or you're seniors yourselves, or you're connected in some way to either of those, or students, of course. So if anybody wants to come up to the microphone here and ask a question, I would like to encourage you to do so. Or if you, in fact, have a brief experience of your own to reflect on a practice perspective, please. I know you're out there. Who's going to be first?
Yeah, we're in the hot seat here, so go for it.
I know
this
there's
is your
somebody.
Opportunity.
This is it.
We can see you.
Yeah, the light's not that bright, right, Catherine? Yeah.
Maybe someone can help with the microphone, bring a microphone to her. Yeah.
You have to catch it.
Yeah.
Here we go. So this will be, oh yes, a 411 seniors perspective on practice.
Question more for Anthony in the city.
Sure.
You talked about friendly cities or friendly neighborhoods. And I would like to ask the question specifically because it's very broad what you were talking about. We have at our center some of the worst sidewalks.
Oh, yeah.
In Vancouver. And it's not that just the seniors at our center are worried about that. but I have friends who are healthy and falling on, and like a black eye, dislocated shoulder, and these are people under 30. So my question to you is the city planning to have this remedied?
No, it's great. Yep.
Great question.
Yep.
And-
I did say it was in the hot seat, right? So yeah.
You're in the hot seat. Thank you very much.
And that's near Terminal and Main, right? That's
Yes.
the area, Terminal and Main.
correct, yeah.
411 seniors.
So this is where I admit I've noted the sidewalks around 411 because having come to visit and parking down the street and then walking down, I'm like, wow, seniors are navigating these sidewalks to get to your location. So I'm definitely very mindful of that. So maybe just briefly, my role is connected with the city manager's office. So what that means is that I don't necessarily have a home in one of the departments that I think can have a lot of influence about different domains of an age-friendly city. But what it means is I'm trying to do the job of infiltrating all of the different departments across the city, building those relationships with all of them. And in some cases, that work involves I will say tying a nice age equitable bow around the work that they're doing and saying, great, keep it up. You're doing excellent work. We're just framing it now as this is something that actually makes the city more age equitable. And in other cases, it's about how do we improve that. And I wish I had my statistics in front of me right now, but I've been liaising with the folks who are responsible for sidewalks in the city of Vancouver. It's actually 3 different teams. Did you know that? In 3 different divisions? There's folks that do the sidewalk repairs. There's the folks that put in new sidewalks, and then there's the folks that put in the timers around crosswalks and things like that. So these are actually different teams, which is an interesting way to do it, but that's okay. They all work together, which is great. But there are, I want to say it's, don't quote me on this, but I think it was $600 million backlog in sidewalk repairs and gaps in the network at the moment. And it is somewhere in the neighborhood of $1 to $1.5 million a year budget for sidewalk repairs. So by that rate, the city will never be able to make all the repairs needed. Thankfully, the city staff know this, and they are socializing this with decision makers and building the case for why that budget needs to be increased, right? So this is a long-winded way of saying, yeah, we're doing it one square a sidewalk at a time, is what I will say, right? But the city does look at, they apply a lens to where these gaps are, where the repairs are needed, and definitely proximity to senior centers is one of those key criteria. So I'm happy to chat with you more about that, but yeah.
Someone else is coming forward? Good.
That's great.
And just as an aside, Winnipeg was the very first inaugural age-friendly community in Canada. And I don't know if any of you have been to Winnipeg lately, down to Portage and Main, the main streets, and walked along those sidewalks. They're treacherous. So, so this is happening in a lot of places. Yes, please. Introduce yourself, please. I know who you are.
My name is Linda Forsyth, and I'm from Costco as well. And I'm also involved with the Voices of Burnaby Seniors. So I spent about 12 years ago time walking around Burnaby looking at the sidewalks. I'm not sure what's happened with them, but anyway. My comment actually is around what we can do, and especially with this division between the rural and the urban situation for seniors. And one of the things that we've been doing, or I've been doing, because I do the newsletter for Costco and I do membership for Costco, is that we've decided that there's a lot of small communities in the north on the island who don't have a lot of access to internet and would like to be more involved. And one of the things that I think we can do, and I've started to do, and probably will get the wrath of our treasurer, is send out boxes of newsletters to them so that they get the hard copies, then they can sit around together read them, and talk about some of the issues that we've been talking about in the city. Also, we have some, that's one thing. Another one we have is have some new people on our transportation committee who are bringing in the whole rural transportation issues. And the fact that in the federal government, we just got some money for train renovation. I guess that's what it's called. I'm not sure what it's called, something. But anyway, it's around getting the trains up to speed so that people like seniors can move around in them easily and can actually go up to the observation cars. Also connecting the trains, because we don't have any more bus service in the rural areas. So what are people supposed to do? And I was just at, we went, the two of us went to Vancouver Island to deliver a workshop called Stay on the Road, Driving After 80. And and what's involved in that. Mm-hmm. And we had to we work with ICBC on this, and we had to get ICBC to put in a whole new section on rural driving. Mm-hmm. So one of the things is you don't have any hard shoulders on the road. Mm-hmm. So where are people who are on bicycles or in wheelchairs, but the electric wheelchairs, where are they to travel to on? Where are they to travel on, and when they're there? So there's those kinds of things, but I think we need to be reaching out and saying, what have we got here in the city that we can support people in the other areas and try to, because we've got a lot of similar problems, we have a lot of different problems too.
Yes, excellent point, Linda. Thank you very much. I don't know, John, did you want to speak a little bit about resource inequities from a rural perspective?
Yeah, I can definitely speak a little bit to Port Hardy, definitely, because I was just there. I can say it's a very lovely place to drive around because there are no traffic lights at all. So that was a welcome change. And there is a bus service, which is amazing. However, it's one bus, and that's it. So it's pretty obvious, I think, when you're there that those issues are very relevant. One thing that I thought kind of came to me through the various discussions, informal and through interviews, though, is it's interesting to me how people are willing to. They almost feel as though there's a trade-off from having this wonderful access to nature and living a life that is very active and trying to stay in nature as long as they possibly can, versus having all of these amenities that you would have in a city. So I was somewhat surprised by how practical people were, saying, yeah, the emergency's closed, but it's such a beautiful place. So I was pretty struck by how cavalier the attitudes were in some ways, addressing that. But I think you're right, and it's kind of the point I think I was alluding to at least earlier, that we don't have a great deal of understanding probably what works in cities and how to apply that to other areas, because things are somewhat disjointed, and certainly that was the impression from the people who were making decisions for Port Hardy. They were very much focused on what they had to work with as opposed to what they could do. So I think you're very right. I'm not sure what the answer is. They're chronically underfunded, so yeah.
We'll wait for your and Shauna's analysis of your qualitative data you were speaking to. And I think also we can sort of talk a bit about the issues of leveraging support across organizations. Many organizations rely heavily on volunteers. They're very under-resourced, and quite often helping each other is a way to make some grounds forward. In fact, there's a lot of examples of that being done in the SHIRK project that we're involved in is trying to come at it from that angle as well. And I was going to ask Catherine to talk about, like, that's kind of the small steps is what we heard Linda was doing, sending some hard copies of a newsletter to help engage older adults in communities where they don't have of internet access. But I think John also wants to jump in quickly on something.
I was just going to quickly point out the senior center in Port Hardy is mind-boggling what they've been able to accomplish with incredibly little resources. They kind of have adopted the idea of spending money to make money in terms of grant writing. So they've hired somebody with professional grant writing experience to write grants for them that they identify. I honestly don't know how they identify them. There's really two women that are absolute forces of nature that push everything forward, and they've found such innovative grants that have life-altering, implications to them. One of them was a grant that would allow them to funnel money into paying for taxis, and so it was, there was people that they knew in their community that they were friends with that say couldn't go to church anymore, and they would try. One person would try to pick them up and bring them, but there's a burden I think people place on themselves for asking for help constantly, and so people stop with that. And so this was one way that people could retain, they could make their own choices and take a taxi to participate in events at the senior center, which were numerous, as well as meals and these communal events that they would do together, and then have that money reimbursed through grants. So just to be clear though, this small senior center, it has 340 members, but they've acquired over $140,000 worth of grants. But we've had this idea come up all the way through. The idea of sustainability is probably the main issue, and getting a grant is wonderful, especially when it's for 1 year, but 2 or 3 years is great. But there isn't a 10-year grant where people know that they'll be able to support people in a certain way, so you can't build capacity around those systems, and that's probably the big challenge there. Sorry.
Excellent. And Catherine, did you want to speak maybe to the issue?
I guess what I would say is, I know I focused on small change. But did you turn it off?
Oh, yeah, I think it's working. Yeah, or if not, try this one.
Is that better?
That sounds promising. Yeah.
That just woke up.
It woke
20
up.
people.
It woke up. It woke you up. So I know I focused on small change because that's what I've been doing recently. But I think in terms of big change, and somebody referenced leaders at the top, and I've been very fortunate to work with a CEO who had vision and took away all my boundaries. No, as I mentioned before, no project plans. You just fix this. Whatever you want to do, that works. It helped that he was behind me and everybody, we better do what she says or we're in trouble. But I think that was his vision. Get rid of all the red tape and just go out and do it. And it was, who could ask for a better job? So I'll give you a concrete example. Nursing homes, generally long-term care homes is the better terminology, generally don't provide antibiotic therapy. At least they didn't when I was starting this project. And I couldn't figure out why, because they had nurses in the community that were working for the health authority, and they would go into individual homes and do IV therapy. But there are the homes transferring a resident every day to a hospital for IV therapy. Well, it just makes no sense. I'm not that smart, but it just made no sense. So to make the change, I thought, well, start small. I'm not going to do the whole health authority. Just take one district, one hospital, and surely we can do this. And as I say, it's not rocket science. And it just makes such a difference. But if I didn't have that CEO saying, just go forth, and I'm sure everybody thought, I don't know how she got here, and there's probably something really nefarious about this relationship. So they were terrified, right? But it was, he had a vision, and he paved the way. And I think, you've all referred to some volunteers doing that, and I think, and somebody said, I can't remember who it was, just said, you know, I'll probably be thrown out by the treasurer, or, you know,
Definitely
it's always easier to do it and then worry about it later, right? And I can think
That's
of
good advice.
when I was wanting to include the LGBTQ community in our home, I thought, well, you know, I mean, I heard them complain. I went to their meetings, and, you know, this is going to be really difficult for us if we have to move into a home. And I did a couple of things. So I thought, well, let's have an LGBTQ movie night. Why not? Half the residents didn't really know what the movie was about, but it didn't matter. There was a movie, there was popcorn, and it brought the community in. I think the other thing we did was we volunteered to march in the, you know, Pride Day parade. Well, that was fun. There was a bus, and the Prime Minister was there, and he came on the bus, and everybody was so excited. So, you know, I mean, some of the community wasn't happy in terms of people living in the home, but that's okay. It was a step forward, so you have to take risks, I think.
All right, well, I think on that note, on behalf of everyone, I want to thank you for this wonderful set of presentations. They were not only interesting, but brought some humor as well to the day. Thank you so much. It was terrific. We could talk all day.